Hello and welcome everyone to this panel session on Malaysia Healthcare Day organized by Bursa Malaysia and Maybank. Together with us, we have two distinguished panelists. Right next to me is Dr. Kelvin Loh, Group Managing Director of Malaysia Healthcare Berhad, and Dr. Tiffany Ong, Chief Product Officer, as well as one of the co-founders of Naluri, a digital healthcare startup focusing on mental well-being, preventive care, as well as life coaching. My name is Shafiq, and I will be the moderator for the session today. The topic we're going to discuss this morning is about digital healthcare in the post-pandemic era. Now, digital healthcare is quite a broad topic, and I do not think we have enough time to discuss everything with the time we have today. But I'm just going to keep the ball rolling a bit by just sharing a quick couple of points. Especially since the pandemic, where we have seen a lot of lockdowns being implemented throughout the whole entire world. People were relatively stuck in their homes and they could not really travel much. A lot of the essential services would still need to roll on to be provided to the market. One of the studies or research done by McKinsey, they found that, or the survey that they have done, the usage of telehealth itself grew by as high as almost 80 times since the onset of the pandemic. It has since normalized to about 30 to 38 times if you compare that to the pre-pandemic levels. But it goes to show that the usage of telehealth is something that is still gonna be a recurrent thing going forward. Okay, so in order to give better understanding on the digital healthcare topic, I would like to first touch on discussing the market dynamics of digital healthcare. So first of all, I think my first question I will direct it to Dr. Loh. iShish has been rolling out its telemedicine services since 2020. Would you care to share with us how has the demand for your telemedicine services fared since then? And has the demand sort of stayed elevated as we head towards normalcy?
Thanks so much, Shafiq. So, firstly, COVID-19, of course, has been a big, it's a big force. It has changed the way, in a very acute way, quickly changed how people needed to interact with their healthcare service providers. At the height of the pandemic, somewhere around 2020, particularly when it was the Delta wave, that's when it really accelerated. For us, because we operate in different markets, we saw that effect coming through differently in different markets. In India, for example, it reached as high as almost 20% of all our consultations, and that was on a paid basis. In other markets, lesser, but that was during the height of the pandemic. That has now come down a bit, as you said, there's some normalizing. I think because in the end, healthcare is still, for someone to see the doctor in person is still different for most of us in Asia. In fact, sometimes there's a saying that actually just by going to see the doctor, although he didn't do anything, you feel better already. Now, having said that, is there a new normal and new trend in digital space? Will the healthcare consumer now realize and desire that, hey, there are many aspects of healthcare that can be gotten more conveniently, engage in this way, and find that combination between that digital connectivity for convenience at the same time staying high touch in physical? I think there will be a new normal as we go forward.
Yeah, thanks for your response. Dr. Ong, would you care to share with us how has the demand for Naluri's mental well-being and life coaching services has fared since the pandemic? And also, I'd like to add a little bit of a color to it. With the pandemic, there's a lot of talks about the mental well-being of the general population deteriorated because we are confined to a limited space for a prolonged time?
Yeah, no. Firstly, thank you very much for having me here this morning. So I think as Dr. Loh mentioned, right, and I always say this, COVID-19 continues to leave very devastating impacts. But one of the plus side that we cannot deny is that it has truly accelerated the adoption of digital solutions. So Naluri, we've been around since late 2017. And in the very first version of what Naluri was, we were just experimenting with this idea of whether or not Malaysians would be willing to speak to professionals digitally via a asynchronous text kind of method, right? And so we leveraged on Facebook Messenger at that point. We got a bunch of psychologists, dietitians to just message people via Facebook and see whether or not people were willing to get down into actual conversations about their health completely through text. And that was very, very early days, right? And I think as Dr. Loh mentioned, like in the end, there is still this notion, especially within our region, that I want to see the person that is giving me medical or healthcare related advice. So when we started, it was, the majority of people were still kind of, oh, I'm not sure, right? Yeah, maybe I can ask them like 1-2 questions, but in the end, I want to see someone face to face. But of course, in the last 2 years, I think, since like March 2020, that was when we started to see it really pick up, right? We saw that people had that increased willingness to speak to our healthcare professionals digitally. And I think that was, in the early days, born more out of desperation because then they just wanted to speak to someone. But interestingly, what we didn't see was that kind of trust that people were able to build with healthcare professionals when they see them face to face. So then we saw a spike in conversations that people were having, but then it dropped off very quickly. So then the ongoing challenge, even until today, right, is trying to see how can we leverage on digital to compensate for the lack of face-to-face interaction, to compensate for the lack of ability between a healthcare professional and an individual to build rapport online. But definitely, I think, on a high level, if we just look at numbers, we have more users than we even projected that we would. I was sharing with some earlier, when I joined Naluri, we had like less than 10 people. And today, we are over 220 people across 6 markets. So even in my wildest imaginations, I would not have expected the growth at this pace, but then there's definitely the demand. But then now, as I mentioned, it's about really converting those one-off conversations, right, where people ask for very specific advice to building that kind of like doctor and patient relationship. And I think, Ashafiq, your second question around mental well-being, right, I think mental health went from something that was a bit of a taboo. In fact, in the early days when we wanted to talk about mental health or holistic well-being, because then in the end, what we should eat, right, if we are at risk of hypertension, or the kinds of exercise that we should do, or how many hours of sleep we should have. I think all of us here, we know what is good for us. But then there is a barrier between knowledge and also actually converting it to actual behavior. And we believe that that gap can be closed by having a mental health professional address the mindset change that is required in an individual to actually practice what they know is good for them. But then when we started out saying that, oh, I'm going to pair you with a psychologist or a counselor, people immediately went, oh my God, I'm not crazy. I just want to lose some weight. Why do I have to speak to a psychologist? But then now more and more people actually understand it, right? It's not so easy to just go out for a run, right? Because then I have irrational fears about catching an infection, right? I have irrational fears about whether I will be as fit as I was before. And I think that's where, again, people are appreciating now that when you speak to a psychologist or a counselor, it's not that you are crazy, it's just that you could do with some support from a mental health perspective.
All right, thank you very much. So the next question I would like to throw back to Dr. Loh. As a hospital operator, given the fact that medicine is a very wide aspect, so which specific areas or disciplines within medicine do you see to have the best transition from a physical standpoint to a more digitalized provision of services?
So to answer that question, we must think about the whole funnel, right? As I call it, from the well person to then the person who has some pre-illness and then getting into illness and something quite acute. So we think about the health-seeking journey to answer that question. And from that perspective, then I think it's quite obvious that that part at the top of the funnel are more amenable to digital connectivity, right? IHH, of course, we have built the brand, the capabilities on that actual bricks and mortar service. Today, we are 80 hospitals in 10 countries. So we serve the patients at the part of the funnel where they become sick. A patient who has appendicitis and comes in the middle of the night will need a surgery in our hospital. Person who has a pancreatic tumor that needs surgery and chemotherapy needs to come to the hospital. But the digital tools are now available like never before. Connectivity is available like never before that enables us to connect also with the healthcare consumer in that pre-illness phase, right? Mm-hmm. It could be simple things as somebody looking for general information, advice, and then to starting points in the journey where they come for health screening, get results, and then they get back information and trends of their health results. From there, then you continue giving advice, and if there's illness, then they try to do triage or look for ways to get then into the healthcare system, look for a doctor, look for a specialist. That still can be done online. Some parts of primary care, teleconsult, I think will start to gain traction, some bit. But that's beyond that, that's when then that interaction needs to happen for the healthcare consumer as well, because then that's when you cannot then continue the healthcare journey online.
Okay. My next question I would like to throw to Dr. Ong. Since Naluri has been involved in the likes of mental well-being, preventive care, life coaching. So these are essentially services that is easily can be provided to the market via digital channels. What are the areas beyond the current areas that you have explored in Naluri? Do you think you can be able to expand?
It's a good question, and I think the short answer is that I think there is a lot, I think within the three areas you mentioned, right? Like preventive care, mental health, and life coaching. Within that three areas in itself, there is a lot more work that needs to be done, right? Because I think, again, I share the same sentiment as Dr. Loh, right? If we think about a patient's entire healthcare journey, for us, the biggest value of digital comes with the prevention side. Because then in the end, in any given population, you will see that there will be, 10-15% of people who will need like acute hospital care, right? Like if you need a surgery done, like you need to get that done. But our focus, and I think where we think that digital has the greatest strength, is to focus on people who are not yet in that red zone, right? So how can we focus on people who are still in the green zones and still in the yellow zones? And this is where having a digital tool allows you to do mass assessments or mass screenings, right? Just based on questionnaire, but then you detect people at a very, very early stage. And then with that, you equip them with the knowledge so that they change their own lifestyle, so that hopefully we get to a point where we can actually reduce the percentage of people that then require chronic care. Right? Because then I think if you look at research around even longevity, right? So yes, we all know that we are living longer than ever before, right? I think, 1970s, the average lifespan was like 34, 35 years old. But today, our average lifespan globally is 76 years old. But interestingly, if you look at the percentage of good years that an individual has, we actually haven't moved that much. So even if we are living, so what I mean is, even if we are living until like 76 years old today, on average, people spend 50% of their lives battling with some kind of chronic condition. Because then we either get, like I actually have high cholesterol. So people are actually getting chronic conditions a lot younger today because they are not living well. So then I think in terms of, will we expand into other areas? For now, not in the near horizon, right? Because we really want to tackle on like, how do we do prevention well? Because if we don't do prevention well, then year on year, we'll be battling with the same percentage of people or even more that actually need acute hospital care.
Okay, thanks. Okay, let's move on to the topic of discussing a bit more on the operational intricacies within the digital healthcare platform. I would like to throw this question to Dr. Loh. So IHH has been rolling out telemedicine since 2020. Could you care to elaborate a bit more to the audiences what kind of investments that you are putting on in order to integrate digital health to your core traditional services that you have in the market?
Yes, we are investing heavily in digitizing our services. We announced that we're looking at probably something like 400 million ringgit over the next 3 years. Now that of course has the IT foundation part where we digitalize our processes, and so instead of having paper forms, more and more of that is digital, and then that makes processes more efficient, that enables us to collect more data. The second layer then is the digital front end that interacts with our customers. We desire to build on what we already have in the bricks and mortar world, create a seamless connectivity into the digital world. So for us, we don't see that as a separate digital play, but it's part and parcel of the expansion of the way by which we connect with our patients. We have some of those components already, as you mentioned, teleconsult, different interaction points. We are in the midst of, we'll soon launch in Singapore and then Malaysia in the next year or so, a much more widened digital offering. And then the third part of that is to use data much better. Now, use data means obviously in an anonymized way, not personal data. Personal data, of course, is private for patient. But the anonymized data gives us rich insights as we go down this journey for us to transform care for the better. And better means we need to find ways to customize that care journey for the individual patient, number one. Number two, for us as a acute and provider of very many complex treatments, then to reduce that cost, help to bend that healthcare cost curve also for the healthcare consumer, so they can get good clinical outcomes while reducing that consumption. So that's what we're trying to do.
Okay. Okay, Dr. Ong, now that we have heard from IHH, so obviously they are coming from the standpoint of being asset rich, so they have all the hardwares under their disposal, but Naluri is coming from a pure digital player. So correct me if I'm wrong, is there a barrier to invest in more wearables, more hardwares to further improve your preventive care services that you roll out to the market?
Well, obviously the biggest barrier for a startup is investments. Okay. So we would love to, and I think again, data is king, right? Because then data is what we need in order to personalize any of our members' journeys. And Naluri, in fact, the digital health space is quite big, right? We stubbornly want to play in this space known as digital therapeutics, which essentially means that we will reach a point where we can reliably predict whether or not a person will get health outcomes. So similar to drugs, right? In the most traditional therapeutic sense, if you have a certain condition, right, if nothing changes, you take the meds, right, you adhere to the dosage that has been prescribed, your likelihood of your condition getting better is there. You can put a percentage point to it, right? 80, 90% that you will, drop in your cholesterol levels or whatever it is, right, that you're battling with. We aim to be able to do the same. So if someone, for example, joins the Naluri coaching program and their blood sugar levels are, say, their HbA1c is, 6.2, right? And we want to be able to be in a position where we say that, okay, if you stick to the program over the course of the next 6 months, when you do your HbA1c test again, we will be able to guarantee that you can drop down to 5.9. right, or 5.8. And then that brings us somewhere close to what some other medications can also deliver. So that is our ultimate dream, right, to be able to then provide therapeutics digitally at scale. Because then an individual also doesn't necessarily need to rely on just medication, right? Just through changing their lifestyle, just through changing their behaviors, they can actually see quantifiable health outcomes. So in an ideal world, we would love for the opportunity to have, a series of wearables that are tied to Naluri. At the moment, we have our own weighing scale, we have our own glucometer, and we also have our own blood pressure machine, just to reduce the barrier so that an individual can automatically sync their results onto the app. But we would love to have so much more, right? We would love to be able to sync sleep data. We would love to be able to analyze their sleep, right? Because then we know that the amount of sleep that you get has a direct relationship with the decisions that you make in the day, right? If you're stressed, if you don't sleep well, right, you will most likely go for the sugary drink, etc., etc. So we would love to have all those assets, right? But again, as a startup, prioritization and investment is usually the way that we decide on kind of which assets we choose to prioritize or we choose to integrate with.
Okay, yeah, that's very clear. Okay, let's move on to the topic of challenges, and I think it's worthy of a topic to discuss. And I'd like to keep this question as open as possible. So for Dr. Loh, as a hospital operator, what are the main challenges in integrating digital healthcare into your system?
There are technical challenges. There's data standardization, interoperability, and a lot of technical issues, cybersecurity, of course. But I think that those are the technical side of it, right? From my point of view, in the end, we have to come back to who are we doing all these things for? And we are doing this for the patient. Or if you go up the funnel, then the healthcare consumer, right? Which means that as now there's proliferation of the ability to engage digitally, like the work Naluri is doing, and there are many others. There are players like us also doing this space. There are different, there are companies producing wearables with them very specific verticals within that healthcare, producing apps. You'll find on your phone after a while there's a proliferation. I don't know, maybe you have 5, 6, 7 healthcare type apps. Then the big challenge in my mind is that how do we find a space that integrates that healthcare seeking journey for the patient? Because it's quite tough, right? If you're going to have one app that's looking at diabetes and its management, and then you have another app with IHH healthcare that helps you to get into seeing your specialist, getting your medicine and hospitalization for some complications of diabetes every now and again. And then you have another app that helps you with managing obesity, and weight management and different connectivity, different IoT things. Wow, I think that's a tough environment to navigate. So I think that's the biggest challenge, and it behooves us as players in the healthcare space to help our consumers bring that journey together. This is a space that's evolving. I think in some other industries, you have seen now convergence and in effect what are super apps in retail space and such. In the healthcare space, I think we'll all need to move forward to find ways that helps our healthcare consumer bring this whole journey together.
Understood. Dr. Ong, would you care to share with us what are the challenges that Naluri has faced along the way as you roll out your product to the market? And has this challenge evolved throughout the time?
So we faced, I mean, the challenges have definitely evolved. I think from the early days, it used to be just, how can you do digital health, right? A lot of the feedback that we get in the early days was, your product is too early. Malaysia is not yet ready for something like that. But thankfully, then the conversation has completely changed, right? I think in the last couple of years, you see that there is a very high kind of investment into the digital health space, although it is slowing down in the past couple of months. So I think the challenge around like acceptance of a digital health solution is definitely, it's no longer there, but it is now, again, I think to Dr. Lo's point, how do we create something that our members would use, right? Or that people who need these kind of like healthcare related support, like how do we create something that they will stick with for a duration of time? Because then with an app, and I don't know how many apps all of you have on your mobile phone, but I have over 100. So what makes one app better than the other, right? And especially for Naluri, like because we want to focus on prevention, we are essentially trying to get people to prioritize their health when they are not yet sick, which is very, very, very challenging in this region. And I almost need to tell my healthcare team that they need to deal with people who don't necessarily want to talk to them yet. But then we know that if we don't go down this prevention path, then again, we are just always trying to fight, trying to find like the most cost-efficient solution for someone who is already sick, right? And as a society, we need to help people earlier in their journey. And so there is this challenge of like, okay, how do I make it as seamless as possible? And again, as a consumer, I don't expect my healthcare app to behave any differently from my I don't know, my social media app, right? So even if we are a chat service where an individual can speak to a healthcare professional, they don't have this understanding that, oh, my healthcare professional might be busy. They are not going to respond to me as quickly as a customer support agent, right? So as a consumer, you expect it all to be the same. And of course, now with more and more people using WhatsApp, for example, again, people expect that instantaneous response. So I think there is a lot around just managing like user expectation, especially digital user expectation, which requires us to broaden our view and not just think like, okay, because I'm healthcare, therefore healthcare needs to operate this way. We actually need to look at it from a user-first perspective, because then if our users are not engaged on the app, then we won't even have the chance to change their behaviors.
Okay, that's very interesting to know. Let's move on to this topic around regulatory front. I would like to throw this question first to Dr. Ong. So since Naluri was first rolled out in 2017, how was the regulatory framework around digital healthcare back then, and how has it evolved ever since?
Great question, and a simple answer as well, because it just has not evolved very much since the early days. And so even for Naluri, for example, we are constantly trying to think about like, how do we future-proof ourselves by getting ourselves certified in other international markets that have a regulatory pathway. So for example, in the States, I think everyone is familiar with FDA, right? In Europe, there is CE mark. And so as a digital therapeutics company, because of the lack of a similar regulatory framework in Malaysia, we are already planting kind of ideas or projects that we can do internationally to set us on a path to be able to be certified that way. Because then in the end, one of the other big challenge for us as our company slowly matures is how do we win the trust of healthcare professionals, right? How do we, and doctors are not the easiest bunch to convince sometimes. And so how do we prove to them that even if we are digital, we can deliver healthcare outcomes similar to drugs or medication? And so within Malaysia in itself, it's something that is still very nascent. It's still something that's very new. But that's where, as a healthcare startup, we need to actively look for alternatives so that we can peg ourselves against international standards.
Okay. I'd like to also throw the similar question to Dr. Loh on the regulatory front, but also to add that IHH has presence in some of the other markets, Singapore, India, Turkey. Would you be able to share a bit of color on how Malaysia is faring against some of the other countries that you are in terms of the how supportive the framework around digital healthcare is?
Yeah, I think it's still fairly nascent in most countries. The reality is that the science is evolving faster than regulations in practically any market that we know. Simple things like teleconsult, of course, I think are getting some traction in most markets. But when you get into then more sophisticated tools which are available and there's more and more proof that it actually works, it's when the regulatory framework falls behind. I mean, simple example is clinical triage, AI tools that can do clinical triage. There is evidence that some of these tools are as good as a primary care physician talking on the phone. There is in the world of radiology, machines can now read X-rays and some scans actually more accurately and with less mistakes than the human can. But it takes time for the regulatory to catch up with it. So can you imagine the day that you come into a IHH facility, one of our Pantai hospitals here, you take your X-ray, no doctor talks to you, you go home and then you get the AI read that tells you what your X-ray result is and what you should do. Would you trust it? You should, actually, because the technology is there and there is increasing evidence that it actually does as good, if not better than human can read. The point being is that there's this proliferation of technologies and capabilities in digital space, digital therapeutics, so increasing evidence that it works. Now, so what do? Then we should, it's chicken and egg, right? The players in industry like us needs to bring this to the forefront, start as best as we can, pilot sites or safe sort of sandbox type situations. Which is what we did during COVID-19 actually, because during COVID-19, the need for all this telemedicine and all was actually faster than regulations could allow. So you do that and then you interact with the regulators, which I think will start to come on as well and start to catch on and start to enable all these things.
Okay, thanks, Dr. Loh. Let's talk about the topic of accessibility because the private healthcare services is often touted as only those who have access to insurance or being sponsored by their own money bank are able to have access to it, and oftentimes the unserved and the underserved are those who have to opt to the public healthcare service. So I would like to ask this question to both of you guys. How do you see digital healthcare being able to provide a similar quality healthcare services to this sort of underserved segment? Doctor, anyone wants to take the question first? Okay, Dr. Ong, thanks.
Maybe, okay, accessibility and digital health. So I think it's a very good topic, and it's actually also an area that Naluri has been trying to get into over the last year or so. But one learning that I had that I didn't realize before is that of course, on a high level, you would see that, okay, if you have a digital tool, right, and you have your infrastructure bill, every additional person that comes on is marginal cost, right, if any. So in principle, you're very scalable because you can serve everyone and anyone. But as I actually got down to doing user group research, I then realized that I was too naive in expecting that an individual from the B40 group have the same digital literacy as individuals from the M40 or T20. And the reality is today, our digital apps globally is designed more for individuals who are comfortable or who have a certain degree of digital literacy, right? Because then, of course, it's this issue where, okay, what is the sample group that you would take to do your user research, right? You would reach out to people who typically seek out healthcare support in general. So then you already start with a biased population. And then when you create something, it is something that resonates with people who are already comfortable using digital tools to go about their day-to-day. But when you deal with the B40, then suddenly I realize, oh, I would need to have a version of the Naluri app that is completely audio only. Because then I'm also dealing with people who are not literate. And then I would need to exist in so many different languages, right? And and then sometimes you're not as quick to be able to translate your app in all those different languages. And there's also that element of different slangs. So that's where I think this whole notion around digital health provides more accessible care. It is true, but there are its limitations as well. So.
Thanks. Dr. Loh?
Yeah, I think first of all, the role that public healthcare plays and private healthcare plays, I don't think that can be changed by digitization per se. But digitalization can do the same thing for both sides, which is reach more people in more convenient ways and deliver it such that it reduces your cost of care, right, over time. Because for the same physical asset, by right, you should be able to reach more people. For us, for example, we have almost about 15,000 beds. And if we then start to be able to shift some of that care online, less acute work that is more consultative, informational, providing in nature, then you can free up that space, right, in the hospitals for acute care, and therefore overall your infrastructure costs to patients should actually come down. So that logic should also apply to the public healthcare system as well, and I think that's one of the big advantages of this whole digitization journey. But again, I come back to emphasize the point that it is even as we do that, it's important that we are able to link that whole digital healthcare space and the physical space, because there's no such thing as digital as care that's only digital or care that's only physical, right? And if we do that well, then overall, my point is then we can help to bend the healthcare cost curve both in private sector and public sector.
Okay, thanks very much. I think we have about 10 minutes left for our panel session. I believe a lot of you guys would have a few questions to ask to both of our panelists over here. I will pass the microphone around. So if you guys have any question you want to ask, please raise your hand. And just shoot the question to the panelists. Before we see one hand being raised, just a quick question for Dr. Loh. Could you also share with the audiences the investments that IHH has done on some of the digital healthcare startups, mainly Dr. Anywhere, Us2.ai, and I believe Lucent's Health as well?
Yeah, thanks for that. So we do have a innovation division. And what we are trying to do is firstly, internally transform and innovate by which the care that we are delivering, improving processes, applying technology that improves that process. But secondly, also we recognize that we cannot just build and do everything ourselves. There's plethora and proliferation of good startup companies which are having specific niche and creating capabilities that we don't have. So some of these are examples. Some of these are examples in the process space. Some of these are examples in the clinical capability space. So Lucence is an example of one of these disruptors or innovators in the clinical technology space because they are doing liquid biopsy. So why do we want to invest in a liquid biopsy company? It's because, yeah, if somebody has something in the lung and you're trying to figure out if he has cancer, in the current times or in the older days, you have to bring the person into hospital, go into operating theater, intrusively poke in a trocar into the lung, biopsy the tissue, have the tissue read by pathologists, put the patient in HD and then in the ward for 1-2 days. Well, if you can get the same diagnosis by drawing a blood that's liquid biopsy, why not, right? So then you improves that care for the patient and reduces morbidity, at the same time reduces that cost. So in my mind, we are doing all these investments to advance care. It's the same goal, right? To simply make care better for the patient from the point of view of better clinical care, but at the same time also help them to reduce the cost or improve the value of that of what we provide.
Thanks. Do you have a raised hand here? No? Okay. Okay, just a quick question for Dr. Ong. You know, there's a saying, prevention is better than cure. And Naluri is, you know, focusing on the preventive medicine for the market. Would you be able to share with us some of the statistics as to how much has, you know, your services, preventive care, help in minimizing or reducing the severity or the chances of critical illness? Thanks.
Great question, and I think that is one of the crux of that's the crux of the issue with prevention, where if you prevent something from happening, how do you quantify the value that you have brought? Because then one would also argue, but now we would never know, right? And so for us, we have always taken this approach where typically what we do with our clients, so we are primarily B2B, is we always start with doing a health screening on day one, and then we do a health screening after our program as well. And what we try to achieve is then for the individuals who are at risk, right? So say they are overweight or they are obese, 1, 2, or 3, we aim to reduce their BMI by at least 5%. Now, why do we aim for 5%? It's because then at 5% weight loss, that is considered a clinically significant improvement that then literature can tie back to your likelihood of getting a chronic condition. So then that way, we are able to estimate what is the ROI of that 5% weight loss. Because if you only lost like 1, 2%, then I can't say for certain that I have prevented you I have prevented a stroke from happening 20 years down the line, right? It's a very difficult conversation to have with employers or any of our other stakeholders. And that's where we peg ourselves against certain clinical outcomes, right? And so it would be 5% on BMI. For HbA1c, we aim for at least a 0.5 drop, right? Again, because then we know from the literature that if you were to reduce by this amount, if not a condition reversal, if we were to reduce by this amount, then we would reduce your likelihood of getting a chronic condition by at least 30 to 50%. So then we use that kind of methodology to estimate our ROI when it comes to prevention.
Okay, got it. That's very clear, thanks. No hand raised. Okay. Just a final question that I have. Perhaps this is something that is a bit outside of the area that you guys are involved in. But how do you see digital health help in assisting how to improve the pharmaceutical industry in Malaysia? I will try to extract an example in US, and I believe the issue is not similar to what we are facing now in Malaysia. But in US, there's an issue of crazy drug prices, where the Americans tend to have to pay a lot more for similar medicine that they can find in some of the other countries. So I would like you guys, for both of you, to share your perspective, if you have some, as to how has digital health helped in further improving the procurement of pharma products, be it in Malaysia or in Southeast Asia. Any of you guys have any insights to it? Perhaps Dr. Loh, as a hospital operator.
Yeah, we're a hospital operator. We're not pharmaceuticals. We are involved in the supply chain insofar as we need that supply. Sure, I'm sure there are. So one of the things that we are doing is using data to make our procurement much better. Procurement and usage. So it's not so much just simply bargaining prices, but it's studying patterns of our usage versus outcomes, and then say, hey, for the same outcomes, can I use something at a lower cost point, right? So all this data and analytics clearly helps. Digital tools that shorten that whole supply chain cycle from try and procure to actual getting the drug, I think certainly helps. Can we imagine much beyond that, and the digital world would disrupt the whole supply chain as we understand it today? Suddenly patients are just buying drugs online as you would from like furniture from through I don't know, Lazada or whatever. I think there are risks, clearly. Drugs are drugs for a reason, right? Medications for a reason. There are a lot of drug interactions. There are different situations that drugs are not suitable for one person versus another. Maybe basic off-the-counter things, I suppose that's okay. But the rest is complex, and I don't think you can just simply bypass the medical care delivery system as today.
Understood. Yes. So it's well regulated in such that digital healthcare, may not really improve much on the what the existing systems already is.
Hello.
Yes.
Hi.
Okay, we have a question. Thanks.
Hi, my name is Muzakir from Hong Kong Islamic. So I want to ask, Dr. Kelvin did mention about super app for healthcare service, digital healthcare service provider, right? So do you think that we can leverage on MySejahtera to be one-stop center to channel to our digital healthcare players, not only for COVID-related things?
Well, I guess I'm not best positioned to comment on MySejahtera. But I guess the question that I think of that as in more the public healthcare space, right? And something that initiated by government or Ministry of Health. Is there a role for in country for a kind of app that helps connect public healthcare service provision, help to guide that? Yeah, for the same conversation that we had earlier, that digitization will make healthcare more efficient, reach more people, make it more convenient. I'm sure there's a role in public systems. For IHH, I think there's an exciting possibility. Now, using the word super app is a big word, but we envisage that given our presence in the bricks and mortar space and the deep clinical capabilities that we have, as now we expand into that digital healthcare space and start to provide services to patients digitally more and more, that possibility is actually fairly enormous. I alluded to that we are creating our own digital healthcare ecosystem, and question around, do we also partner with other players? The answer is yes. I don't think, as we build this out, I don't think we can do everything ourselves. Can we bring on players, partners into this digital healthcare ecosystem such that from the healthcare consumer point of view, IHG is not then just providing or pushing our services, that's ours, but truly empowering the patient to choose based on his or her needs, whichever part of the funnel, whichever part of the journey. For me to empower our patient and healthcare consumer to do that, then not saying that we'll create a super app, but creating the broad ecosystem where we then partner with various players and create that connectivity, create that choice, transparency, and empowerment, I think will be a future of where we like to go.
Yes, we have one question over there.
Hi,
Please.
my name is Syed Arya. I'm from Bursa, Malaysia. I don't know if both of you have read the book Life Force by Tony Robbins. No? Okay. It's a book I'm reading now. Tony Robbins, what he does is he's making cutting-edge healthcare accessible to the masses. He did that in the financial crisis with his book on personal finance. And in that book, what he's done is spoken to all the leading experts globally about aging, and in many different parts of healthcare, and most of it is under clinical trials. Some of it's approved. Now, my question is, are either of you willing to be able to be a facilitator to what he's doing? He's got a website called Life Force. What I find is that it's difficult, the time zone and physically not being there. For example, they have clinics in New York that you can just walk into and do assessments. So I think telemedicine will help. But number two is also use the distribution network that you have in the region as well. So it's a bit out of the box, but I'm just saying that, is that something that you would be willing to consider? And when you do read the book, please do get in touch with me. I'd like to hear your thoughts on that.
Yeah, no, I think finding like-minded people is it's not always easy. And so if there is an opportunity, sure. I think if it fits, yeah, why not?
The goal sounds similar, which is to find ways to empower patients and healthcare consumers to make more choices. I think that's a great goal.
Thank you for the remarks. Any questions from anyone else?
Can I just ask one more question for IHH, please?
Yeah, sure.
It's not to do with the telemedicine, but what are your challenges you're having in Hong Kong and China? Hong Kong and China at the moment, and also in Turkey.
Sorry, can you repeat the question?
The challenges that you face in Greater China.
Business question.
Yes. And
Okay.
And also in Turkey.
Okay, I wasn't sure that this plenary was meant for IHH business question, but very briefly, post-pandemic, we're recovering well. Turkey, domestic, foreign volumes are growing very strongly. In fact, we're looking to expand our hospitals. In China, the market is where it is now. The COVID-0 strategy means a lot of restrictions in private healthcare, so I think we have to watch that space and evolve with the market.
Yeah, thanks, Dr. Loh. Okay, I believe we do not have any more questions from the floor. So I would like to wrap up this panel session. Thank you very much to Dr. Loh and Dr. Ong for providing the time to join us as the panelists for the session. And I believe the audience will have gained very insightful knowledge on digital healthcare. We hope to meet you guys in the future. Keep in touch. Thank you very much.